Aotearoa and thinking about complex social systems. And I should add, developing conceptual and empirical tools for their analysis. She speaks today in the context of an extraordinary pandemic, accompanied by equally extraordinary innovations in health systems and in political economies. COVID-19, its distributed and uneven effects, and the diverse responses it propels as a resource for and a spur to health system innovation. Anna.
Tēnā koutou katoa, ko Anna Matheson toku ingoa no te herenga waka aho. So I'm Anna Matheson, and thank you. And yeah, so it was, oh, how long ago? How long ago was I here? 10 years? 12 years? Something like that. It's nice to see some faces even from that time. So anyway, yes, I'm going to talk about, get that other way so I can pace. Talk about this idea of reorienting health systems. Oops. Ah, no, that doesn't work. Okay. Oh, and that doesn't work too. Okay. Anyone with technical expertise about how this doesn't work? Always happens. Every single lecture I've done this year, something like this has happened. No. So what do I have? Can I just do? Oh, sorry. Oh, yeah, no, that's just go back and forwards. All right, so before I get into the topic, I thought I might just talk a little bit about context for my thinking. And I know that you won't be able to read what's in the bubbles or what's outside the bubbles, but bear with me anyway. So this is a map of the evolution of the complexity sciences over the last 80 years or so. And it was put together by Brian Castellini, who is the head of sociology at Durham University. And there are just a few things about this map that I find interesting. Oh, thank you. And that I'd like to point out. So, and if this may or may not, oh yeah. So this is 1940s, 1950s, and this is sort of to now. And what you see here is that where thinking is at, there's been a heap of work done around thinking about complex systems in terms of health and social systems, and more of it's happening. Another interesting thing about this map, and again, I know you can't see all those names out there, but if you could see all those little names outside the bubbles, you'll see that there's hardly any women there at all, so just saying. But one woman who is really interesting and you might know about is this woman here, Danella Meadows. And Danella was a chemist and an environmentalist, and she did, and colleagues did some really important work where they wrote a report in 1972, the year that I was born, so a long time ago now, called The Limits to Growth. And that's where they modeled the unsustainability of economic growth for the planet. So almost 50 years ago. She unfortunately, so Danella ended up having a career where she was really focused on promoting systems thinking. And she died too early. So she died when she was about 59 in 2001. And so I'm not going to go into this much. I just want to introduce this idea. So one of the bits of work that she did was this, what she called a hierarchy of places to intervene in a system. So Danella had created this, and she thought of it as a work in progress. And she hoped that other people would work on it and develop it further. And so it was from her knowledge of the behavior of systems, so any system, and probably mostly the chemical systems that she had an interest in, she thought, what are the things that can change the state of a system or change the trajectory of a system? And so she did this hierarchy. And so somewhat effective are sort of numbers and things. A bit more effective might be changing the feedback relationships in a system. A little bit more effective again might be the explicit rules and the design of the system. But the most effective thing she suggested for transforming systems was about sort of changing the underlying intent. So changing those usually rules and things that can't be seen and sort of the mindset and paradigm of the system. I'm not explicitly going to talk about this, but I have a view that the extractive nature of inequality, you know, drives the underlying intent of our systems. But that's another story. Yeah. Sorry. Thanks. Right, and just before I get on with the actual talk, another thing I just want to say. So complex systems and complexity is quite a particular thing. It's not just that everything's complex. There are rules and there are concepts and there's a bunch of ways of thinking about it. So Yun Yang is a really interesting woman who's written widely about the transformation in China and from a systems perspective. And she also wrote this. So embracing complexity is more than just ingesting a new menu of buzzwords. It's a practical agenda involving concrete analyses of problems, data collection, and organizational design. And a few years ago, I became an associate investigator with New Zealand's Centre for Research Excellence for Complex Systems, Te Pūnaha Matatini. And that's been quite an amazing connection to have. Because what complex systems thinking does, it gives a shared language around processes and around how outcomes arise that you can discuss across disciplines and across levels. So just wanted to say that. Right, to the topic, reorienting health systems. So you all know, most of you will know about the Alma Ata Declaration in 1978, which was a global call for strengthening primary care, which is, you know, a pivotal cog in the health system. Almost a decade later, the Ottawa Charter, which promoted the need for stronger community action and reorienting health services. You might be less familiar with, there's been a global move towards people-centered health systems, which has taken an explicit sort of complex systems approach to thinking about it. And the World Health Organization has done this little figure which they use to show sort of the building blocks of a health system and, you know, how they need to relate to each other and how they need to relate to people. And it's when I talk to my my second year Bachelor of Health students about this move to people-centered health systems, and they go, "What? Isn't that what they're always meant to be?" And funnily enough, that's just not how they've evolved. And, you know, and so for the most part, they've evolved, you know, with financing either at their centre or power of the professions at their centre. So not people in communities. And you all will know about the Commission on the Social Determinants of Health. So that was a global review of the evidence that we have about what causes health and well-being, and the Commission concluded that most of health is created in the places we're born, live, work, play and age, and actually the health system, the formal health system itself is quite a modest contribution. So from the late 70s to the early 80s in New Zealand, so for the last 40 years, we've known that in New Zealand we have a socioeconomic gradient in health outcomes. We know that we have significant health inequalities by ethnicity, Māori and Pacific in particular. And then in the last couple of years, there's been a bunch of these quite big system reviews that the government and various organisations have undertaken looking at progress. And we haven't made heaps of progress in that time. At the same time, I saw some analysis recently of the Household Economic Survey, which showed that wealth inequality in New Zealand, which also already was very high, has got even higher. And there's a UN report out this year which was warning about, you know, the trajectory of accelerating wealth inequality globally, and arguing that it was destabilizing democracies. So, you know, this is a worrying picture, not great, but I also think it's a chance for a stop take, you know, on what we're doing. So that picture, you know, so despite everything which has gone on, despite the fact that we have evidence, despite the fact that there's been intention, policy intention and other types of intention and investment around changing outcomes, we're still reproducing them. Our systems are reproducing them. And one of the things which I think has been a problem and a contributor to this is the way that we think about solutions, which has been similar to the way that we think about problems. And the way that we've understood problems has often been, you know, identifying single issues. And then we also do that same approach when we're looking at the solutions. Also, when people talk about even structural change as a solution, often they're only talking about top-down, the top end of structure, you know, and that sort of end where you can, again, identify the problem. So one of the things I really like about this idea of reorienting health systems is that it's a systemic response. And also that just by what it's suggesting, it recognises local structures as well. So as Jeff said, I have spent a long time, can't believe it's 20 years or so, it's just amazing, it goes so fast. So a lot of my research has been, over the last 20 years, has been talking to different types of organisations who operate locally, and it's kind of around what constrains action, you know, what are the things that they need or could help with them being able to achieve health goals. But in that time and through all that listening and talking, there was a few things that I noticed. One is that, so this is about sort of that policy view, is that we don't seem to think that communities need effective organisation. It's like they're just there. And in fact, the way that we invest in communities, and certainly in some of the work I've done evaluating Healthy Families New Zealand, shows that the way that we invest actually undermines effective community organisation. I also noticed that communities and the way that we implement policy doesn't treat communities as if they have pre-existing contexts. So as if they have pre-existing relationships, pre-existing organisations, and pre-existing activities already going on in them. Another thing I noticed was around that the community people that I was dealing with were much more stable than the policy people over this time, you know, which is not surprising given the, you know, almost continual reform of the health system and the change in priorities and change in people. And definitely, as well, one thing I noticed was about the voice of communities, particularly in all sorts of decision-making avenues and pathways not being equal. So I've been really lucky over the last 6 years to be involved in evaluating a Ministry of Health funded initiative called Healthy Families New Zealand, which was trying to address some of those issues, which I just talked about in communities and the way that you implement things. So Healthy Families New Zealand has been run in 9 communities around New Zealand. It's there's a health promoting workforce in each of those areas. And what the teams are meant to be doing is facilitating and adding value to existing action around health and wellbeing issues, to what they call strengthen the health prevention system, including sort of joining up leadership around health as well. I won't go into it. I've written some stuff and people can ask me later, but there have been lots of great local outcomes from the initiative. There's been increase in health promoting settings like workplaces and events and schools. There's been initiatives go on to try and make the relationship between local providers more reciprocal. And there's even there's been a lot of sort of local policy change as well, particularly around tobacco and alcohol. And then there's also, because of the nature of the initiative, they've been able to share a lot of stuff. And so they've also been looking at food systems and trying to develop a national strategy, but from a local perspective around how you sort of make regenerative, resilient food systems as well. And so this work that Healthy Families is helping to facilitate, there's actually tons of it going on in New Zealand at the moment. Amazing stuff and amazing sophisticated approaches, using collective impact models and other things. So a few years ago, I met a woman called Kate Dern, who was the Director of Public Health of Wigan Borough and in the UK. And she shared with me some work that the council there had been doing around trying to improve health outcomes amid sort of austerity measures that the UK government was putting in place. And so they had this idea of what they called the deal, which was about improving the social contract and reciprocity between community and local council. And they've had some really positive health and social outcomes, including in deprived areas, increase in life expectancy, as well as a bunch of other stuff. And so you can have a look. I won't go on because I'm going to run out of time, but you can have a look. It's really interesting. And recently I got some people shared with me this idea of community wealth building, which has been taking place in the US and the UK. And what's so interesting about this is that it addresses the issue of economic power and tries to reorient labour markets, land, control over land, procurement processes, what you do with investment. And so it's quite an interesting approach. And again, you can go and have a look at that one as well, more about that. And one of the reasons that the basis for that, that the arguments for this approach was that issue of sort of declining democracy. And so how do you bring communities along, and how do you create trust in democratic processes and things? So that's one of the underpinning behind it. So you can have all those wonderful, innovative, fantastic things happening around the place, and bits and bobs all over the show, but without a system that supports those activities to continue to occur and to spread and scale even, they're not going to be ultimately reaching the goals of which they've been put in place in the first place. And so to go back to those, that idea about system strengthening, which when the World Health Organization, so rather than reform, so system strengthening. So these are some of the things that if you were going to reorient the system around people and communities, you might want to think about. So evidence, technology and communication, all of them, and which doesn't always happen, about them being context sensitive and locally useful. I know certainly in the Healthy Families teams, that issue of getting locally useful evidence is a really, really big one and an ongoing challenge. Approaches to service design, which are responsive and flexible. financing and investment strategies that don't undermine wider goals. So like that issue of I talked about before, of when you have competitive funding processes, it can undermine organisations collaborating with each other. Valuing workforces appropriately. I was teaching my students about, I was talking to them about the mental health and addiction inquiry, and we were looking at the workforce. They have a whole bunch of really lovely quotes, and for the most part, the mental health workforce feels unsafe and undervalued, you know, and so how can it be doing its job if that's the case? And in contrast, the Healthy Families teams, which are health promoting teams, which are often not overly valued as well. They have been valued in this initiative, so they had really good professional development and you know, competitive incomes as well. So something to think about. And then there's that idea of distributing leadership and governance. So not having leadership all centralised in the top end, you know, strengthening the system by having it spread throughout. So there's a move around considering organisations like hospitals, like local councils, DHBs, for example, as local anchor institutions, which themselves can role model behaviours. And I've had some really wonderful talks recently and shared a lot of ideas with a fellow called Peter McKinley, who runs the local government think tank here in New Zealand. And he's been doing a lot of advocacy around trying to push the idea that local councils really should be well more involved in governing for local wellbeing. And to achieve these things, you know, of course, one of the things that has to happen is, and a tricky thing that has to happen, is widespread culture change around the way that organisations behave and of course, the incentives that are used. You know, I think there's, I think there's a lot to learn about cultural safety and how that was or was not implemented, you know, in terms of if there was ever going to be a widespread trying to think about how you're going to change the culture. Yeah. Right, so going back to Danella's hierarchy. So if I was to think about what are the paradigm shifts that might be needed. So I reckon there is a need for humans to shift their gaze to whole systems and all the details that that entails. You know, it changes what you think about what the system levers might be for change. It's not just economic levers, for example. You know, I think actually the system levers are within our systems, like looking at those, understanding that local community structures are actually really sophisticated. And if you understand the way that complex systems evolve, you know, sensitivity to initial conditions and all, you know, it's a really important place to intervene and to sort of spread and grow values and whatever. And so, yeah, so thinking about, you know, instead of the public sector thinking about themselves as the centre, you know, I think it's an interesting idea to think about communities themselves at the centre, and then what would that mean for perhaps the way that the public sector operated and the types of initiatives and the types of approaches. And oh, so am I? What time is it? Am I good? Oh, good. Okay. And so yeah, and so finally, you know, paradigm shift around what our systems value. So the Financial Capability Commission did a survey amidst level 4 lockdown, and it found that 30% of people were sort of slipping into difficulty, financial difficulty, and 40% was slipping into hardship. And of course, the people who were most affected were the people already in precarious situations, employment, housing, all those things. You know, other work that I've done and been involved in as well has just seen how just the insecurity in our food systems as well for particular communities. So I suppose, you know, COVID-19, which I haven't talked about much, but what we saw and that you know, I just sort of found it staggering how quickly communities just had no security, you know, and just seemed completely not right to me. Right, my little Latvian granny, she died last year, but she loved a good saying, so I'm going to end with a couple of sayings. That's Danella Meadows there, and so she says, purposes are deduced from behaviour, not from rhetoric or stated goals. And so that's the case for individuals, for organisations, and for communities. And then an oldie but a goodie, and still relevant. We cannot solve our problems with the same thinking we used when we created them. So thank you for listening. And these are just some bits and pieces of writing I've done over the last couple of years with wonderful colleagues, sort of looking at system relationships, just in case you're interested.
Thanks, Anna. And we open up to questions now.
Nick.
Thanks a lot. That was great. I'm just thinking in terms of the New Zealand context where, say, the power of big food, big tobacco, big alcohol means that the central government is not supporting an environment for community action and community development. You know, look at the alcohol issue in particular. Communities have spent a vast amount of resources to try and deal with the current alcohol legislation and make progress with very limited progress. So it seems like this is great, but until we fix that nexus of the central government and the big corporations, it's going to be hard for communities to flourish much. It just seems so rotten at the top in a way. It's hard to have progress, it seems to me.
Yeah, no, indeed. And you know, none of what I talked about is easy at all. You know, I was being a bit aspirational and a bit, but I suppose, so it's like where you start as well. So definitely, I mean, there's a story of when I was out in Aotearoa, and there was a hard-won battle about getting a liquor store across the road shut down. And the amount of community energy and resources that had to go into that, you know, for something which is so clearly not good for the community, you know, was astounding, you know, and it's probably something that wouldn't happen in all communities. You know, I think, yeah. So those ideas about, so it's about how you shift things. So those ideas about community wealth building, you know, we've had limited success, like government address industry and address this. But what if you brought communities along, did things which just started to change the environment and to change who had the power and to change trust and processes? So we've got this, you know, that's what complexity shows you. And some of the people that I've been working with, Anna Matheson, you know, even how disinformation flows through systems and disrupts and, you know, changes, you know, what people will do and what they believe in and things. Yeah, so it's a challenge, and it's not one or the other as well.
So thanks very much, and we have a question online from Tanya Wilton.
Sorry.
Do you have a comment or reflection about whether enacting the Simpson report will reorientate the health system to move patients to the centre? Do you have suggestions that may be more successful?
I do have a lot of thoughts about that, actually. And what are they? Well, it's interesting because we still don't even know what's going to be implemented, of course. Until after the election, we probably won't know. I thought there clearly was a lot in there and some real pearls of good things as well. I thought there was the emphasis on those top-end structures was too much. You know, I just, in my head, I was imagining all that time setting up those things, probably a couple of years, still nothing happens in communities. It just happens again and again and again. I also wonder about, you know, getting rid of PHOs and the DHBs. You know, I know that they weren't, they as organisations hadn't been implemented as they were intended to be implemented. And so do you fix up that? You know, do you try and make them work better, or do you just get rid of them and start again? I'm sure. Yeah, so thoughts. I've got many other thoughts too, but I won't go.
Thanks, Anna, for those great insights. I actually did have a related question about the Simpson report, and if we hadn't had the COVID crisis, I think we'd be here discussing the Simpson report and what it means. I'm quite interested because of whether you make this a big distinction or the separation between healthcare services and public health. And because I know some of your comments seem to put them together, I'm just wondering, is that holding up? Is that holding back population health? The fact that
it's seen as separate?
Or even that it's so dominated by healthcare delivery, and that's actually drawn resources out of population health. And I guess that great debate about whether we do need a separate agency that can really focus not just on determinants, but also moving us away from short-termism, which is, I think, also another thing that's been holding us back, and whether that we need a separate agency to hold on to or I guess implement the kind of ideas you're talking about, or whether it is best to keep pure population health tied up with healthcare delivery as we have been doing.
Yeah, I mean, I think the reality is they're not separate, like just the reality of it. I mean, you know, even when I said that comment about the DHBs and the PHOs, you know, one of the things that both of them have failed to do properly is engage with their local communities, and particularly around determinants of health and stuff like that. And so that seems to be where we're falling down, you know, creating another central leadership to say that again.
Just a question about wages, work and jobs. I'm used to aspects of that, certainly coming to the fore periodically over some decades, really. Certainly more recently, it doesn't seem to last very long. People questioning why people are unemployed. I don't know the health field really terribly well. I know when the pressure was on, or has been on periodically, to take work and jobs out of the economic agendas. People go for the need for a mortgage and a house rather than persist with the need for a job. Was it ever there in health, and did it ever disappear?
Sorry, which bit? What?
Oh, sorry, the idea of work and wages and job you mentioned, for instance.
So definitely. So one of the, you know, all the work that's been done over the last 20 years on the social determinants of health, of course, income and employment are critical ones which underpin, you know, many other issues. So yes, it is. Oh, sorry. From the health agenda? I don't know, actually. Yeah, I mean, certainly, I just find it interesting that I recently seem to be one of the voices talking about the social determinants of health, you know, when we so know about it, you know, and, you know, even when I heard all the stuff about, which is clearly really important about the Otago and the doctors stuff which was going on recently, but you know, where's that same outspokenness about the determinants and about communities and stuff as well?
Hi, I'm just wondering if you know, the big sell-off over the past years of public housing, and you talk a lot about community, and that's the grassroots. Do you know how that's affected communities, I guess, because people of all socioeconomic backgrounds are spread out now, rather than, you know, we would have had public housing with a demographic of people who you knew you could target and support. But now we have people in all sorts of situations spread out, sharing flats on private rentals. And do you think that'll have an impact at how you target communities? Because where are communities now?
I think that, you know, in the work around showing the deprivation index is still, and the fact that, you know, there's a real strong argument that area-based communities, there's a strong relationship to health outcomes. And there's a strong argument for targeting areas. I don't know if there was ever a time when we had an easy approach to targeting communities. Certainly, you know, housing, and I shouldn't be talking to Philippa here in the room. You know, housing's another, you know, so despite, you know, the amazing work that Philippa's been doing and others around housing over the past 20 years, we still haven't made progress on housing. Yeah.
Thanks, Anna. Of course, you can talk about housing. You worked on it for a large number of years. I think we are making progress, actually. But nonetheless, I was going to ask you about the, I see that you've written a paper here on the Sustainable Development Goals, which I'm also really interested in. And I understand and support the idea of complex systems and communities and institutions working together. I just wondered if the change, what you thought about the change in the framework that the government has to wellbeing goals, where you don't concentrate on economic matters, you include actually cultural matters, social matters, and environmental matters. Do you think a change in a framework at that level, which is the one that all government agencies and local governments are essentially expected to work in, is a productive way of making a change?
It depends. Depends what happens. And actually I wrote when the Wellbeing budget first came out, actually I wrote a blog for the BMJ about that issue, about, you know, all good as long as it ends up reaching communities this time. Because, you know, it's all those top-end changes, and what seems to happen is we don't end up doing much at the community level, and therefore outcomes don't change.
Thanks, Anna, for a really interesting talk. I've tended to come from the complex systems sort of side of things, more from the perhaps the male-dominated kind of computer, robots, and AI and climate sort of models.
Which this group, Tupuna Hamaditini, a lot of them are in there. So.
Yeah, I was thinking that, looking at the data knowledge insight underneath there. So what I guess my question is, does that kind of approach, does it meet your agenda at some place, or
I think it contributes. I mean, I suppose one of my issues, I've got many, is just how, you know, for me, what that complex system thinking does is give a way to talk about big system processes, which isn't economics and isn't necessarily quantitative. And yeah, personally, I think that's important because it feels like a lot of those areas have been beyond critique in terms of our big social processes. But I do think that there is a place for all those, for you know, better modelling, and but it's like, you know, having a mixed method approach to trying to understand anything.
Hi, great talk, thank you. Hi. It seems that part of the problem is a listening problem. How do you think that can be improved?
from me? Or
no.
With my answering of the question?
I'm talking about, like, people on the back blocks of Gisborne or whatever, compared to,
yeah, definitely.
Here in the Beltway.
Yeah.
Like, I mean, I as a student nurse in the 80s, I went to the marae where Aotearoa filmed Whale Rider, and there was a social policy group doing a kind of grounded round of the country, listening to people, wrote a huge document, got filed away. I don't know whatever happened to that. It's probably really relevant still now. But do you know what I mean? Like,
yeah, that issue of...
How can the listening improve?
Yeah. That culture change issue, so when I made that point, not all voices are equal, and they're always the same voices which aren't heard as well. And if that's about engaging with public institutions and decision-making processes through governance or whatever, we have to have better ways of making sure that those voices are heard, so it's about governance structures and things. Yeah.
Do we have anyone else? Question?
Sorry, I can wait for hours with an uncomfortable. I do this in my classes when I'm waiting for someone to have questions, and I can just be here for all day.
I do have a question.
Oh.
In Simpson report, in a kind of way, follows a New Zealand genre, which is that the answer to things is to centralise them more.
Yeah.
And the thread that it follows is fiscal control. And it's written by people at the centre, and it reflects the concerns of people at the centre very largely. So that is a continuing theme in New Zealand life.
Yeah.
And it goes along with incredibly weak systems of local and regional government of one kind or another.
Yeah, they lack capacity at the moment.
Absolutely, they lack capacity of all kind, yeah. And I'm just wondering, in thinking about creating new lives for communities, actually, and thinking about ways to make a more effectively working, broadly health system, is not, it seems to me, to not think about the centre and the important things that only it can do. But there seems to be an incredible lack of imagination in New Zealand about thinking what might be done through a local government or a regional government frame. And I just wondered if you had some thoughts on that.
Sounds like you probably know more than me, but certainly, and these talks with Peter from local government think tank, that's exactly what his argument would be about what's happening in New Zealand and what he's been really strongly advocating for, including trying to. So there was, I think, the last amendment to the local government bill was a local wellbeing one. So local councils have the ability to govern for local wellbeing now, but they don't have the capacity probably, or the fiscal control maybe as well. And also there's the public sector legislation bills before Parliament at the moment. And if you go and read that, it's a lovely reminder of just how terrible those neoliberal reforms were in lots of ways. And it's trying to fix up. So one of the other things when I'm talking about, we haven't devolved stuff properly, we've had many years of whole of government approaches or intersectoral action type approaches, which again also haven't been overly successful. And so the bill before Parliament at the moment explicitly recognises that and is trying to work to think, how do you do that, when actually we've got all these issues which compound and interact, they're not all separate. Yep, that's it. Thank you for listening. Turn that off. How do I do it?